Gonna come closer. Okay, we're gonna drop to the radiocarpal joint. Everybody know the first row of carpal bones? Say it to yourself. Speaking of poor blood supply, right? Hey, there we go. All right. I like this one because it's going to reinforce a lot of what we talked about and hopefully leave you all feeling super successful. Stabilizing hand, radius and ulna. Okay? Where'd that towel go? I'm finding out I'm not very nice to my patients. That might feel a little bit better. I am firmly keeping him there. Okay, I'm not jumping on him, but I'm firmly keeping him here. Now, my brain is, it's kind of scary to get in there, but my brain looks at this as a U, right? My concave, right? And this as a rounded, my convex. So I know that if I pull this way and drive down, I can help extension, right? And if I bring him this way, a little bit of a gap and drive down, I can help flexion. Like that's just, it's great. It's easy, right? Kind of. So the goal today would be to be firm with this and be able to, watch what I'm doing here, like they are touching, y'all. I'm as close as possible. And then EJ feels a little bit of a squeeze and pull. We would call this distraction, right? We don't have a graded assessment for that. We don't really document that. We're just distracting. And then I would find my R1, R2. You okay? Mm-hmm. He had a little click. R1, R2. There are techniques where you push them into extension. Right now we're just assessing in neutral. So you want to be able to do this wiggle. You can pull up, but when someone's post-op ORIF, you got to get some energy. So going supinated and driving that way is better. Does that make sense? To get a little more force to reinforce that movement. So to wrap it up, this is our last thing for the day. We'll get a take home and get out of here, okay? Stabilize as close to radial ulnar as you can. I'm feeling the styloids and I'm on them. I'm getting as close to that as I can. I'm getting a little pressure, and from here on out, EJ feels like 40% at all times, and then the rest of it is this guy. So a little bit of space. Look at my forearm, straight down. I'm gonna overshoot it a little. That's a little soft tissue-y. Pull back. That's his joint play right there. Cool. Do a P to A and an A to P. Reinforce R3.